In medicine, some tools are like a really sharp sword. They can be incredibly effective, but they can also be dangerous if you're not careful. Today, we're breaking down one of those tools, a medication called clonazepam.
But first, let's start with a little thought experiment. Just imagine for a second that your mind is a runaway train. It's just barreling down the tracks full speed, and you have absolutely no way to hit the brakes.
Well, for people dealing with certain types of severe seizure disorders or really debilitating panic attacks, that's not just some analogy. That's their reality. Their nervous system is essentially stuck in overdrive, with electrical signals just firing off uncontrollably. And this is exactly where clonazepam, which you might know by its brand name Klonopin, comes into the picture. It's a medication that was designed, quite literally, to be the emergency brake for that runaway train. So how does it actually do that? How does this medication manage to pull the brake on that out-of-control train? Well, the answer is actually pretty brilliant. It doesn't have to build a whole new braking system. It just makes the one our brain already has way, way more powerful. Okay, so let's meet GABA. You can think of this as your brain's natural built-in brake pedal. Its whole job is to slow things down, to reduce all that electrical excitement, and just keep everything in a state of calm and balance. Now here's the really clever part. Clonazepam doesn't add anything new to the system. Instead, it finds the GABA that's already there and basically gives it superpowers. It makes the brain's own natural brake pedal incredibly more effective at slowing down all those runaway signals. And because it's so good at this, it's officially approved by the FDA for things like severe seizure disorders and panic disorder. Now, you'll also see doctors sometimes use it off-label, meaning for things it wasn't officially approved for, like restless leg syndrome or really severe short-term insomnia. But, and this is a big but, that powerful calming effect comes with a price. Getting that level of calm isn't without some serious risks. So let's flip this around and look at the other side of this double-edged sword, the hidden costs. The most common side effects are pretty much what you'd guess would happen if you slam on your brain's brakes, right? We're talking drowsiness, dizziness, and some trouble with coordination. A lot of people also describe this kind of brain fog, where it just feels hard to concentrate or think clearly. But then, there's this really bizarre thing that can happen. For some people, the drug does the exact opposite of what it's supposed to do. It's called a paradoxical reaction. Instead of making them calm, it can actually cause agitation, irritability, even aggression. The brake pedal suddenly acts like an accelerator. It's wild. And all of that brings us to what is, without a doubt, the most critical part of this explainer. Beyond those side effects, there are dangers so serious that the FDA puts its highest possible level of warning on this drug, the black box warning. This right here is the FDA's black box warning. And let me be clear, this is not a suggestion. It is a life or death alert. This quote makes the single deadliest risk crystal clear. Mixing clonazepam with opioid medications can be fatal. So, why is that combination so incredibly dangerous? Well, both substances slow down your central nervous system. When you take them together, their effects don't just add up, they multiply each other, potentially slowing a person's breathing down so much that it just stops. And the exact same risk applies to mixing it with alcohol. And if you get past that immediate danger, long-term use has its own trio of really serious risks. First up is tolerance, where your body just gets used to the drug and you need more to get the same effect. That can lead straight to physical dependence, where your body literally needs the drug to function normally. And for some, that can spiral into addiction. This is so important to understand. Because of that physical dependence, you can never, ever just stop taking clonazepam cold turkey. If you do, it can trigger a really dangerous withdrawal, including life-threatening seizures. The only safe way to get off it is with a slow, gradual taper that's supervised by a doctor. So you hear all of this, and it begs a huge question, right? How on earth do doctors and patients weigh these incredible, sometimes life-saving benefits against these really substantial risks? Well, that balance is going to be different for every single person. And it's an especially tricky calculation for certain groups. For the elderly, for instance, the risks of confusion or a bad fall are much, much higher. And for anyone with a history of substance abuse, the risk of addiction goes way up. Which brings us to the fundamental rules for using a medication like this responsibly. It really all boils down to minimizing risk. Use the absolute lowest dose that works for the shortest amount of time possible, and always, always work with your doctor, especially when it's time to even think about stopping.
At the end of the day, a good way to think about clonazepam is like a fire extinguisher. It is an incredibly valuable tool for putting out a raging, out-of-control fire. But you wouldn't use it to manage a small campfire, right? It's a crisis tool, which means its serious risks make it a poor choice for the long-term management of something like general anxiety.
And that really leaves us with one final big question. For a tool this powerful, this sharp, how do we make sure that it's actually helping more than it's harming? Well, it takes a ton of respect for the medication, a deep understanding of the risks, and a constant, open conversation between a patient and their doctor.